Hi, I'm Sukin Shah. I'm a pediatric orthopedic surgeon, and I also do scoliosis surgery. I work at the Nemours Alfred I. DuPont Hospital for Children in Wilmington, Delaware. Scoliosis is a lateral curvature of the spine, typically seen either on physical exam or x-ray, but the important components of scoliosis are also a rotation or a corkscrew of the spine and a flattening, sometimes, of the middle of the spine. Scoliosis is known as a lateral curvature of the spine, but what you should know, it involves three different dimensions. For the side to side, and also a corkscrew type of rotation. We also see some flattening in the middle of the spine, sometimes when the spine is viewed from the side. Well, we don't really know what the true cause of scoliosis is, and that's why most of the scoliosis we diagnose in teenagers is called idiopathic scoliosis. But we do know there's a genetic component, it runs in families, but what we know doesn't cause scoliosis are things like backpacks or bad posture or different physical activity. Exercise is good for your back. Idiopathic scoliosis is the most common type of scoliosis, and it affects about 3 to 4% of the U.S. population. We don't know the cause of idiopathic scoliosis, but other types, such as congenital scoliosis, are something that you're born with, a congenital vertebral anomaly of the spine, or the spine bones are misshapen. And neuromuscular scoliosis is typically caused by a muscle, brain, or nerve disease, such as cerebral palsy or spina bifida. Scoliosis is one of the most common spine problems that affect children. Children are most affected by scoliosis during the growth spurt, but virtually anybody can get it later even in life, such as due to degenerative disease or arthritis. We don't yet have a cure for scoliosis. We have different treatments that, when applied to different scenarios, might make the curve stable, perhaps even a little bit better, and certainly there are always surgical alternatives for severe scoliosis to make the curve straight. Scoliosis is typically not a painful condition. If you are having pain, you should see your doctor immediately. If pain is one of the symptoms of idiopathic scoliosis, it may not be truly idiopathic, and sometimes additional scans or advanced imaging is necessary to get to the bottom of the cause. If you have a small curve or you're fully grown with a small curve, typically your curve will not get worse. Curves do get worse sometimes. When you are going through your growth spurt or you have already a pretty large curve and just living on a planet with gravity like Earth, your curve could get worse if it's already very severe. Scoliosis can lead to other health problems, especially when the curves are severe. We know that adults with severe scoliosis can have back pain and disability doing certain activities. And certainly the curves can get worse with age. It does lead to certain problems also with your heart and lungs in the very late stages when the curves are very severe. We think certain types of scoliosis do run in families. That makes it a genetic type of disease. We don't know yet what gene carries the curve. It's probably multiple genes and some environmental factors. But if someone in your family has severe scoliosis, you should be checked for it also. The best way to find a good doctor is to trust your primary care physician, your family doctor, or your pediatrician. They have a network of different providers who could be right for you. Other ways to find a good orthopedic doctor are the Scoliosis Research Society at srs.org or your local children's hospital. If you think you might have scoliosis or someone has told you you might have scoliosis, don't panic. Most of the time, curves are small and may not even get worse. You should see your doctor and perhaps even get an x-ray and see a specialist who deals with scoliosis type problems to know for sure. We're not quite sure how vitamins and certain exercises play a role in scoliosis or back health, for instance. We do know that things like calcium and vitamin D and routine exercise are very important for your spine and for scoliosis treatment. And you should see your doctor for specific recommendations regarding those activities.